Hello, good afternoon, good morning, and good evening, everyone. Welcome to another Ask WHO Social Media Live Q&A session. My name is Yanawit Deshpanyawat from the Department of Communication at WHO HQ in Geneva, and I will be moderating the conversation today. I think a lot of you may be aware, or maybe not. Today, we celebrate World Sexual Health Day on the 4th of September every year. And this is an opportunity for us to highlight the importance of sexual health for everyone's well-being. Our discussion today will touch on a range of important topics, such as stigma and taboos around sexual health, consent, gender equality, pleasure, and management and prevention of sexual health problems. And it is my great pleasure to have not only one, but three special guests with us today. First off, we have Dr. Leanne Gonsalves, WHO scientist for sexual health. Next, we have Dr. Anand Patel. He's general practitioner and sexual function and men's health specialist. And last but not least, we have Lisa Mangaldas, sexuality educator in India and Pleasure Project ambassador. Welcome, everyone. I'm so glad to have you all with us to discuss this very interesting and important topic today. All right. First off, I think to kick off our conversation, Leanne, perhaps you could do us the honor and give us the answer to this burning hot question of the day. What is sexual health? What does it mean, really? Is it just about like safe sex or using condom, or does it mean more than that?
Yeah, thanks so much, Yanowit. It's a great question, and thank you for having me today. I think your question is a very natural one. I think it's when we talk about sexual health, it's most easy to see it as something that's pertinent to folks who are in their reproductive years or those who are currently sexually active. So it's really common when people say, yeah, it's just safe sex and condoms. And safer sex, when we talk about that, we're talking about making sure that people who are having sex are taking measures to prevent sexually transmitted infections, including HIV and HPV, and that those who are having penile vaginal sex are taking measures to prevent unintended pregnancies. Condoms are a great way to practice safe sex. Safe sex is part of sexual health, but sexual health is so much more than that. When we talk about sexual health, we're talking about physical, mental, emotional, and social well-being in relation to sexuality. And with an umbrella that broad, it really means that sexual health is relevant throughout a person's life. So for us at WHO, when we're talking about areas that are relevant to our sexual health, that means that here we're paying attention to everything from menstruation to menopause, gender affirming care, comprehensive sexuality education. We're looking at sexual pleasure and sexual functioning, prevention of gender-based violence, prevention and control of HIV and other sexually transmitted infections. And we're also looking at how our sexual health evolves throughout life. And a great example of that is how our sexual health and gynecological needs evolve and change after pregnancy and childbirth, or how things change as we become older adults. I think that what underlines all of this is that, we take a holistic and a positive approach, which recognizes that sexuality is a natural part of the human experience. And therefore, our sexual health is going to be an important part of our overall health and well-being at any age. So big area.
Thank you very much, Leanne, for a very detailed and clear explanation. And now I'm pretty sure that our viewers might be wondering, because talking about sex or sexual health or sexual difficulties nowadays is still a taboo in many places and societies. Lisa, you have been working so hard to change the nature of such conversation in your country in India. Could you tell us briefly how did you come to this, and why do you think it's so important to talk frankly and openly about these issues?
Thanks so much, Janowit, and thanks for having me. So in India, sex remains a very taboo subject. And as a young, unmarried, sexually active Indian woman myself, trying to navigate my sexual health, particularly, as I entered adulthood, because I've been doing this for a few years now. It was such a sort of minefield, and it shouldn't have to be that difficult. We live in a country where less than 10% of men use condoms, where homosexuality was decriminalized only in 2018, where marital rape is still legal, where premarital sex is frowned upon and marriage is posited as an inevitability, not a choice, especially for women. And so, to be a non-doctor, to be an unmarried woman talking about sex, to even know about sex seems transgressive, right? Sluts know about sex. Only a slut would know about condoms or contraception or take birth control. That's the type of mindset that I am pushing back against. And there's so many people who are with me on this. I'm overwhelmed by the support I've gotten, but largely the prevalent sort of social attitude to sex remains one of stigma and shame. And that has huge consequences, because a culture of shame means people don't feel comfortable accessing resources around even health, let alone pleasure. You're going to be struggling to even buy condoms as a young person without worrying about what the chemist is going to think, or all the stares you're going to get in the store. It's not an easy thing for a young Indian to do. Let alone find a gynecologist, without your parents being part of that process. Most people only see a gynecologist for the first time after marriage and when they're trying to get pregnant or they're delivering a child. It's very reproduction focused for the large part, especially when it comes to women's sexual health. And so all of that, for me, it had consequences in my life that I wanted for it not to be that way. And so I really just started talking about sex on the internet, never thinking it would become as big as it is. Today, my sexual health platforms reach millions of people. They're one of the most popular platforms on the subject in the country. And why is it that people are coming to a stranger on the internet who's a non-doctor, who's not even a public health professional like me? Because clearly even those people are failing to do this properly here. Unfortunately, even in doctors' offices, even in family planning communications, there is often a shame and stigma laden approach, a fear and abstinence-based approach, and a refusal to acknowledge that, for example, pleasure is a primary motivation for why people have sex. And it's a valid reason to have sex. And actually, sex should be pleasurable. Something as basic as that is rarely acknowledged. So anyway, I think it's very important to democratize this knowledge, that you don't have to be a doctor or an expert to know the basics about your body, about consent, about contraception, about pleasure. I think it should really just be general knowledge. And so that's what I am trying to do in India.
Thank you so much, Lisa. I agree that we should break the barriers, and it's very important to talk about sexual health openly and freely. Before I go to Anand, I just have this one question from Gloria, watching us from LinkedIn. I think it's a follow-up question to what you just said. She asked, what would be the best way to reach out to rural area regarding sexual health, especially when some places are quite the sexual health topics are quite taboo to talk about it.
So today in India, what's quite interesting is we have among the largest number of smartphones per capita in the world. Some people might not even have a toilet, but they might have a smartphone, because we have some of the cheapest data plans as well. And so we kind of jumped many people might still be illiterate, but might have a phone. And so I think it's really important to harness the internet and doing this work, because it's where young people go to learn about sex in any case, in the absence of sex ed in schools and a refusal from parents to talk about it at home and a lack of access to medical professionals or any kind of formal information about this. People are going online anyway. And so I think to use digital and social media is at this point like a no-brainer. I wish there was also in-person sort of grassroots level programs that could be very strategically and consistently implemented. There are some, and in a strange sort of way, quite an irony is that perhaps in the various politics of social work and who gets seen as target populations and who doesn't is such that often economically disenfranchised communities might be on the receiving end of, like, let's say, free condoms from the government, or some kind of, small group discussions among women about birth control or something like that. Whereas I would say maybe like an upper middle class family who might not be on the receiving end of that type of intervention is not having this conversation at all, because parents are never going to sit with their kids and talk about it, and it's not talked about at school, and the NGO is not coming to their home. So it's a funny one where I think people are quick to make these generalizations that like rural must be necessarily more regressive and urban must be necessarily more progressive, and wealth equals more liberal views and poverty equals less liberal views. But it's hard to draw those correlations neatly, and India is a country of contradictions and surprises, and so I really think that sort of an approach that reaches everybody really needs to be implemented, because sex is such a democratic thing, whether urban or rural, rich or poor. Sex is kind of the same in the way that it works, and so are our health needs to a large extent.
Thank you so much, Lisa, for your answer and explanation. I think I'm just going to go to Anand for the next question. I know you're a specialist in sexual function. Can you explain to us what that is? And what do we need to know about sexual functions concerning our sexual health?
I think when I think of sexual function, it's really achieving the sex life that you would like to have. Now, obviously, that is so broad, isn't it? Because it represents the sex lives of many, many people, and the way they think about sex, and the way they believe each sex act, where it sits within their lifestyle. But there's huge aspects outside of that. Obviously, the social, the cultural, the religious context that you're living in may place restrictions or acceptances of certain sex acts over others. And my kind of job is to try and help people navigate how to achieve that sex life within their cultural environment. And we have lots of people these days whose sexual function is being affected by things like pornography. That both increases the sexual expectations that they may have of themselves, or the way that their partners look, or whether body hair should be present or not, or penis size, or the appearance of vulva, and whether there should be hair or not. There are so many things that, as Lisa said earlier, access to smartphones and access to the internet means that there is a vast amount of information out there. Some of it which is really helpful, other parts of it which are really not helpful in terms of allowing people, particularly young people, to understand their anatomy, understand the importance of intimacy, the importance of the psychology of sex, the neurobiology, how you fall in love, why you make bad decisions when you first fall in love, all of that stuff. I mean, that I would ideally hope is something that we're helping as a group to educate young people about, so that they understand when they're moving forward within relationships, that they can kind of go, okay, look, my body is, it's evolved for pleasure. There are bits of me that are actually enjoy this, but there are certain acts I won't enjoy, and the ability to say no. And I think part of this conversation is also about consent. So the ability to actually choose and deny what you want and don't want, I think, is so important in that conversation. So to summarize, sort of sexual function encompasses, all of the sex acts you might want to have, all of the relationships you might want to have. I think people often think it's men with erections, and should we be giving them just tablets to make that better? And I think it's so much more than that. I mean, I've seen women. I work in an area which has lots of women from South America in London, and actually, I've had one woman come see us saying, I've been thinking about having an orgasm. I wanted to explore that, and she was like, "Well, I've never had one before." And I said, "So you've been married for how long?" We're married a long time, but she was always taught that sex was, the pleasure was for her husband. It wasn't meant to be for her. And she'd been learning with chatting with her friends, looking on the internet, that it could be something she might want to have. And it was interesting taking her on that journey. So hopefully all of our jobs here with Lisa, Leanne, etc., and the WHO, is to help as many people around the world have as satisfying a sex life as they can have, given the culture, religion, and social aspects of their world.
Thank you, Anand. But before we go into more detail, I just want to welcome our followers and viewers who are joining us from all corners of the world. Today's topic is about sexual health and why it is important to talk about it openly and freely. I wanted to remind you that there is no or zero question that is too embarrassing to ask. Just send them in. You can simply leave your question in the comment section, or if you're watching us on X, please use hashtag AskWHO. While we wait for the questions from the viewer, I'm just gonna circling back to Lisa again. You have worked a lot on gender equality and sexual health in your country in India, and we have seen you encouraging women to speak more about their sexual needs and experiences. What do they tell you?
So I think the most common sort of messages I receive from women cover three main themes. One is pain during sex. Like, why does sex hurt? When I look at representations of sex in porn or movies, it looks like the women are having such a great time. But for me, it's painful, uncomfortable, or at best underwhelming. Another common message I get is, I have never had an orgasm. I get this question from younger women, but I also get this question from married women with kids. I'm 40 years old and I've never had an orgasm. And then a third question I get is around struggling with asserting themselves sexually. Like, I struggle to refuse sex from my partner, but I also struggle to ask for sex when I want it. And I think that they're sort of related questions that come from the way gender is constructed in society, in patriarchal society. But I mean, that is pretty much the world globally. So to some extent, I think women anywhere in the world can relate to this idea that sex is a site of duty and pain and shame, rather than a site of joy and equality and a site where women can express themselves. Like, I think we're presented this idea that sex is something that is done to women, not something that women are active participants in. And I think the result of that is that so often, even the male partner, because it tends to be also a very heteronormative construction of sex, the male partner doesn't even think that the woman's pleasure matters, because the way society presents it is that women are supposed to have babies, not orgasms, right? It's your wifely duty. I mean, in our country, marital rape is still legal. So literally the law seems to propose that you owe your husband sex. And I think there's the social aspects, there's the anatomical aspects, the fact that we never learn about the clitoris, for example. Even if you're lucky to have had the biology class sort of teach you the reproductive system chapter in school in India, you're going to see the ovaries and the uterus, maybe the vaginal canal kind of labeled discreetly, but you never see the external genitalia with a clearly labeled clitoris, and then explaining that extends internally as well, explaining that focused and consistent stimulation of the clitoris is the most reliable route to orgasm for most people with vulvas. When do we ever get told that? When do we even look at our vulvas? So many people might have lived their whole life even without having taken a hand mirror and actually acquainted themselves with this part of their body, because the way the anatomy is located, you don't just see it all the time. You kind of have to put in a bit of an effort to take a look. So unfortunately, I mean, many people will respond to me being like, oh my goodness, I just learned today, I was this day many years old when I learned that I don't menstruate from the same opening I urinate from. So I think that the by design lack of information provided to women about their own bodies, again, the by design lack of agency around being assertive about your sexual preferences, your sexual health needs, all of that results in sex often being either uncomfortable or not, it's a place where you're not really exercising your agency. And so the response has to be multi-pronged. It's not just a health and medicine issue, although, with painful sex, like something as simple as lubricant can go such a long way. It's such an easy solution, and yet so many people don't know. But on the other hand, with things like consent and just being able to be sexual, being able to be a woman who says, I like sex, I have sex, that is still near impossible for most people here. So I think the more of us talk about it, the more normal it feels, the less shame-laden it feels. The easier time we're going to have in ensuring we have satisfying and pain-free sex lives.
Thank you, Lisa. It's interesting to hear how people want to speak more about their sexual in different aspects. And from WHO perspective, Leanne, we know that women's sexual health issues receive less attention in health policy and research. Why is that? And what can we do to change it, Leanne? You're on mute, Leanne. We cannot hear you. All right. Maybe I'm just gonna wait for her to try to get the audio back on, and I'm just gonna move on to the next question. Well, we received a lot of questions from the audience, but before I take the very first one, I'm just gonna go to Anand. You have early experience delivering sex education to young people, right? Could you tell? Oh, well, there's one question from, let me see, that is related to this question from Summer Homakjin watching us on LinkedIn. She asked, do you have some tips on talking to kids about sex as they are reaching puberty? But my question to that is, could you tell us what role does this play, the sex education in sexual health, and when is it needed? So it's kind of like two questions
Sure.
related to.
Thank you for the question, and hi, Summer. I think it's quite complicated depending on which country you live in terms of what's acceptable to talk to children, because obviously there's a cultural construct in terms of what feels comfortable to be talking to kids. However, on the whole, I think discussing what your body is for and what it's capable of, and understanding the anatomy from a very young age, I think is really helpful, so that people are not hanging around with the shame and the stigma of not understanding their bodies, not recognizing what's there for pleasure, not realizing their own advocacy. So, I have the ability to control my body. I also have ownership of it. Other people should not be invading my space or touching me inappropriately when I don't want this. So I think learning consent really early on is one of the key things that we can teach people, alongside an understanding of what their body it does and what each bit is for, in a very clear way. And I think you build on that sort of year on year. Now, these conversations can be quite difficult for parents to have with their children. And so I think it's important, like particularly the role of educators out there who focused on supporting young people in their understanding of sex lives, and particularly as they approach relationships. I think a lot of sex ed has been focused on sort of like telling people you must not get pregnant, or you scaring people with the possibility of sexually transmitted infections, whereas actually more of it should be focused on going, well, yes, those are true. However, how do you negotiate within a relationship? How do you understand when you're feeling uncomfortable? How do you deal with those thought processes? How do you deal with the sense of embarrassment or shame? How do you talk about it? I think learning about how to communicate with each other is a key thing, and then hopefully making sure we have an environment, hopefully at home, that they can approach you and talk to you as parents about it, if they want to. I think is the best that you can do for children, because sometimes they just won't come to you with the problem. But I think our schools and other systems have to make sure that there's lots of evidence-based, sensible, helpful information out there, which is relatively appropriate for the age group, so we can build on that rather than scaring them initially.
Thank you, Anand. Lisa, anything to add from your point of view?
I think that unfortunately many parents haven't received sex education from their parents either. At least this is the case in India, where parents will write to me being like, how do I talk to my kids about sex? Because no one ever talked to me about sex. I have no idea where to begin. And I think that dismantling shame is something that you're never too old to do. And in fact, many people have a lot of sexual shame that they've never really been able to unpack if they haven't sat down to think about it. So I think that while you need to be figuring out how to talk to your kids, you also need to be spending some time figuring out your own attitudes to sexuality and your own identity. And I love Emily Nagoski's metaphor of the garden, the idea that your sexuality is like a garden that other people tended to while you were a kid. And so you might have some foliage growing in that garden that works great, that you resonate with, but you might also have some flowers or plants or weeds that you don't like so much and you want less of, or you want to remove altogether, because whether it is culture or religion or of your family's values or other adults and teachers and various influences in your life, you weren't always the one in control of what was put into that garden, especially as a very young person, and often well into adulthood. There's some plants that might need more water and others that might need to be weeded out? And when do we sit and think about this? We're never encouraged to do that, So I think it takes a lot of introspection and deliberate introspection to dismantle shame. And if you dismantle your own shame, you're going to be better equipped to help your child or adolescent have a shame-free relationship with sexuality themselves. And I think it's so important to ensure whatever information you impart is scientifically accurate and judgment-free, because unfortunately there's also a lot of misinformation perpetuated with the stamp of approval of the likes of God men and religious texts and things like that. And I just think it's so important, no matter your beliefs. And I think that faith can be a part of your life while still valuing science and factual information around something like health. To me, they are not antithetical. So yeah, I encourage parents to be honest with themselves first, and then honest with their kids.
Thank you, Lisa. I have this one interesting question from Mohammed Yusuf Noor. He asks, does sex education help kids live a safer life? Maybe Anand, could you take this one?
Sure. I mean, I think enabling our young people to understand themselves and understand their bodies and understand the impact that their actions may have on other people is the basis of how a young person should be educated. And I completely agree with what Lisa is saying. If you as a parent don't necessarily have come from a place where your education wasn't at the highest level, and you're aware of that, and you taking the time out to educate yourself on that is a huge step. But equally, young people having the ability to find this information in as Lisa said, as I have said, in a sort of research, scientifically based manner, that doesn't make them feel as if they're a bad person. So many people have different sexual preferences, sexual types of enjoyment, ways of achieving sexual pleasure, and that sort of multiplicity, that variety should be celebrated and supported, rather than this sort of very reductive way of going, there's only one way to have sex, there's only one way to pleasure, and that's just completely untrue. So allowing our young people to actually be curious and engage with the world, engage with other people in a supportive, safe way as possible, because they will make mistakes. That's part of being a young person, is about making mistakes and saying the wrong thing and perhaps doing the wrong thing, or having perhaps not the greatest experience. But that hopefully will be a learning opportunity. But equally, they will hopefully have the skills to kind of go, no, I don't want that, or recognize what is uncomfortable. So yeah, I hope that answers the question.
Yes, thank you very much. Leanne, are you back?
I'm back. Yes. Can you hear me?
Okay. Yes. All clear. All right. I'm just going to go back to that question because it's very important to address that. So the question is, women's sexual health issues receive less attention in health policy and research. Why is that? And what can we do to change it? Or what have we been doing to change that at the WHO?
Oh my gosh. I mean, I think it's basically what Lisa said when you were asking her about her own work, previously in India, and talking about gender equity norms and how we're all raised. I mean, I think what both Anand and Lisa have mentioned in the last 5 minutes is just, kind of part and parcel of the fact that our sexual health is going to be affected by, the quality and safety of our relationships with ourselves and with the people around us, with our families, with our intimate partners. And it's massively affected by the society in which we live, including the gender norms as illustrated by Lisa and the anecdote she was sharing, as well as, the fundamental human rights that are associated with sexual health. And I think, at a global health and policy level, we're not immune to those things. And so from a global health perspective, I think that rather than focusing on women's sexual health, we've tended to focus more on reproductive functioning, making sure that pregnancy, childbirth, and the postpartum period are safe, that folks who want access to contraception can get that. And I want to be clear that that's resulted in immense global progress in reducing maternal mortality, in meeting need for contraception. And the work in those spaces is not done. But it has kind of come at the expense of us as focusing on, the reproductive functions of female bodies rather than this more holistic approach of, women as a sexual being. And I think, what Lisa mentioned about a multi-pronged approach, about how it's not just the purview of health and medicine, but there are enormous social implications. I think, and I truly believe that we're starting to see a shift there that's affecting in the best and most positive way, the reproductive health space and maternal health space, and creating the space for sexual health. And there's several reasons for that. I mean, we can talk about what we've mentioned here about, positive, holistic, person-centered approach to healthcare, recognizing that when someone comes in, they're more than just the sum of their parts, but they have desires, they have autonomy, they should be empowered to kind of live the lives that they want, both in their sexual lives and within their relationships. But I also want to, because we're on a social media live, and it's been brought up a few times, really flag the power and the impact of this sort of democratization we're seeing of information and experience sharing. I mean, we talked about how, parents may not feel well equipped to educate their children. I think for women of all ages right now, we're seeing this push of folks sharing their stories, women who are talking about their experiences with difficult menstruation on the one hand, or difficult perimenopausal transitions, folks who are being courageous enough to share their fertility journeys and how that's affected them, how long it took them to get diagnosed with endometriosis, their path to understanding their own bodies at any age and seeking and finding sexual pleasure. And I think that ability to kind of reach across countries and communities and find and share stories is huge. And it has an effect on, what healthcare providers are listening to, what researchers are paying attention to, what policymakers pay attention to. And then to just flag that, the role of doctors and sex educators like Anand and Lisa who are willing to step up and be that source of evidence-based information for those who may not have easy access to it is critical as well. And so it's this kind of momentum and this normalization that I think, and I hope, is moving us in a very positive direction in this space.
Thank you so much, Leanne. I'm aware of the time, but I'm going to take the questions from our audience now. I've seen some interesting question here from Annie Fonte Abassi, watching us on LinkedIn. She asked, what are the safer methods and measures given towards sensitizing the local communities on the safe use of contraceptives? Leanne?
Can you repeat that, Yanawit?
Yeah. What are the safer methods and measures about sensitizing the local communities on the safe use of contraceptives? Sorry.
I mean, I think I would refer the person who was asking the question to, we've got amazing resources on WHO's website related to the wide array, something like 25, 26 contraceptive methods, both ones that involve hormones and ones that don't involve hormones. There's an immense number of resources that are evidence-based, that are updated regularly, and can help folks, I don't know what this person works in, but folks who are looking for a contraceptive method that's right for them, their preferences, what they're looking for. That's all available on our website, and there are resources for members of the public, but also folks who are in a healthcare provider setting. So I would refer them to our website, and they'll find a really, really robust set of resources there.
Right. Thank you. Our website is at www.who.int. So the next question I'm going to take from the audience, I think I'm going to give this to Anand. I have a question. Why do some men avoid knowing the knowledge of sexual health?
I want to clarify what I'm answering there. Sorry, do you mind saying that again?
Sorry. Actually, she said, why do some men avoid acknowledging about sexual health?
So I'm wondering whether that's related to, for example, is that trying to avoid the reality of sexually transmitted diseases or the potential outcomes of pregnancy? I'm sorry, I'm clearly being a bit slow when it comes to that, so I want to make sure I answer this.
The question is quite in general, maybe you could address this in a wider
Sure, I'll address it in
sense.
the wider context. So I think so when some people think of sexual function, they're very focused on sort of narrow health conditions like an infection, whatever. What I want to try and make people aware of is how the rest of your health can impact on your sexual well-being. So, for example, if you have diabetes, this is a very prominent disease across the globe. By 2045, 1 in 10 people are going to have diabetes, and therefore their risk of blood vessel diseases and nerve conditions is going to increase, because unfortunately the higher sugar levels damage the nerves and the blood vessels. So it's going to cause erectile problems in men. It's going to cause change in sensation, change in lubrication, difficulty reaching orgasm. So making sure that we are trying to understand our health at a young age and trying to prioritize preventative care is the biggest thing that we can do to try and promote later sexual function improvements. And that can be anything from exercise, which is so important, sleep, and making sure your diet is as good quality as possible, which I appreciate is difficult given foods are becoming more and more expensive, scarcity of resources, etc. And some people have great wealth disparity. But I think there's another question in there that I think the initial question that might be coming through about the fact that toxic masculinity and the patriarchy may have significant impacts on how we're allowed to think about sex in certain cultures, because it's very much their story is how it is, and I think the reality of that has to be acknowledged. Plus, also, the importance of the challenge that is coming. I don't believe the internet is entirely bad when it comes. It allows the democratization, as Leanne was saying, of this information, because there's lots of voices out there that hopefully are challenging these beliefs that are unfortunately embedded and very difficult to overturn. So I think some men are ignoring these health messages because they think they're more important, and I don't think that's true.
Thank you, Anand. Thank you very much. I think we're running out of time now, but before we close our live Q&A session today, I forgot to mention that the theme of World Sexual Health Day this year is consent, which is a very hot topic in many countries. And I think my last question to you is, what should we be teaching people, young and old, about consent? I'm going to give this to Lisa first.
Since we were on the subject of gender, I think that a lot of the ways that we are taught about how we should behave when it comes to sex and consent during sex are very gendered. So men are posited as the necessary sexual predators who must get sex and must, there's an aspect of like conquest built into how courtship is presented to men. And on the other hand, for women, we're kind of told we need to be the gatekeepers. We must guard our virginity, for example, right? Your whole family's honor rests in your hymen. The type of messaging women get versus men get tends to be quite different. And as a result, I think the type of sort of communication between men and women around whether sex is wanted or not tends to be clouded by these narratives of how each gender is supposed to behave. Not only is this a very heteronormative narrative that is imposed, kind of not acknowledging at all that there could also be people who don't even identify within the gender binary navigating consent, or two women navigating consent, or two men navigating consent, etc. So there's many problems with this narrative, but it is the dominant narrative. And I think the result is that often as women, it's very difficult to say no sometimes, but it's also very difficult to say yes sometimes, because you don't want to be seen as easy or a slut, etc. You're often afraid of your safety, and so sometimes the easiest way to exit a situation safely seems to just to get along, to just simply go along with it. And on the other hand, for men, I think that we're not teaching men to deal with a no gracefully. In India, men are routinely in the papers for acid attacks or even for killing some. I mean, intimate partner violence tends to be the most significant source of violence in women's lives, right? Like statistically speaking, your husband or boyfriend or former partner is the most likely to kill you if you look at just how many women die by murder and who is committing those murders. So these are very confronting statistics, but I think it is important to think about gender when we think about consent, because often gender roles as socially constructed play a big part in how we're able to navigate our relationships. I also think it's important that we get comfortable talking about sex. We're not comfortable talking about sex, even if we're having it often. People who may have been having sex together for many, many years may never have actually talked about the sex they're having. And even just generally, like, many people are quite awkward about talking about sex. And so if you're not comfortable talking about sex, how are you going to be navigating consent in that vulnerable moment where you're naked with someone and you're not sure whether, it's a very vulnerable moment for both parties. And so if the topic, even when fully clothed and at a coffee shop, is awkward for you, it's going to be so much more awkward for you in this moment of vulnerability, right? I also think we need to respect and value consent in all aspects of life. Unfortunately, in South Asia, for example, it's very common for young people to be denied any agency in all aspects of their lives. You will be told what to eat, what to wear, which school, what you can study, who you can marry, what profession you can become. In so many ways, your family, your community, your parents, whatever, are kind of dictating for you what you will do. And there's an idea that you must simply do what you are told. You're never really encouraged to think about who you are, what you want, what your hopes and dreams are. And so I think that we need to be valuing consent in every aspect of life, and from a very young age, so that it then just becomes intuitive. You understand consent. You are comfortable talking about sex long before you're actually having it, if that makes sense. So gender roles, comfort talking about sex, and consent as an aspect, a culture of consent, not just in the bedroom.
Thank you, Lisa. I do agree. And the last question for Anand, what is your number one top tip for sexual health?
Oddly enough, which sounds weird here, I would say exercise. If you institute some exercise in early life or at any time of your life, actually, it improves blood flow. And improving blood flow to all areas of the body is important. Certainly improving your heart health. If you think about the penis and vulva, they're often blood tubes. So if you can feed them more blood, you're going to improve lubrication, sensation, etc. You're going to reduce your cholesterol. You're going to reduce your sugar levels and control them much better. Improve your hormonal health. Narrow your visceral fat, which is fat around your middle, which causes health problems. So yeah, I would prioritize sort of exercise, sleep, and diet. Really, is the three biggest things. I know you only asked me for one, but I think they're incredibly important alongside your mental health.
Thank you, Anand. Leanne?
Can you hear me? There I am.
Yeah, I hear you. There you go.
Brilliant. Same question?
Yes, same question.
Yeah, I think, building off of what Lisa said, for me, communication is all. And I think Lisa highlighted the importance of communication between partners. But I would also say, communication with your provider and providers with your patients. I think this goes back to that culture of, we're just not used to talking about this. Imagine if we had the same sort of sensitivity about talking about our diets, we would be in a very different world entirely. And I think this is something that is, such a natural part of the human experience, whether or not you are sexually active at any given point in your life, that if we can normalize talking about anatomy, talking about, where we have pain, our need to connect, if we can make ourselves open in that sense and do so with those who have such a big impact on our health and well-being, our intimate partners, our family, our medical doctors as well, I think that we will be in a much better situation to be able to live happy and healthy and satisfying lives.
Thank you very much, Leanne. I think we are running out of time, really. If you guys want to learn more about WHO, his area of work and activities in sexual health, please just visit our website, www.who.int. Thank you, everyone, for tuning in from all over the world. I'm just going to read some countries here: from Tanzania, Ukraine, Pakistan, Canada, Norway, India, Liberia, South Sudan, Germany, Chile, South Africa, Indonesia, Tunisia, Portugal, and many more. We are super happy that you are here with us. And thank you, Leanne, Anand, and Lisa, for joining us today. It's been a pleasure. And just one last thing, there will be a technical webinar about sex and maternal health right after this Q&A session at 3 p.m. Central European Summer Time. If you're interested to know more about the effect of pregnancy and on sexual health, you can register and join the event at the link that we're going to put it in the comment section very shortly. Thank you again, everyone, and happy World Sexual Health Day.
Thank you so much.